Severe hypoglycemia and lactic acidosis are critical metabolic disturbance that can lead to rapid clinical deterioration and even life-threatening if not promptly identified and treated. In cancer practice, such as a certain malignancy like lymphoma, this abnormality may result from a unique metabolic phenomenon known as the Warburg effect. My name is King Meng. I'm professor and section chief of clinical chemistry laboratory in the Department of Laboratory Medicine at the University of Texas MD Anderson Cancer Center in Houston. Her article titled Persistent Hypoglycemia and Lactic Acidosis in Lymphoma, Implication of the Warburg Effect is set for inclusion in the July 2025 issue of Mayo Clinical Proceedings. I'd like to thank my co-authors for their support and collaboration. This paper highlights a patient with mantle cell lymphoma who presented with persistent hypoglycemia and lactic acidosis, both of which resolved with chemotherapy targeting the underlying malignancy. The key message is that recognizing the Warburg effect in similar clinical scenario is essential, as effective management requires addressing the malignancy itself rather than focusing solely on symptomatic treatment. We describe the case of a 78-year-old man with mantle cell lymphoma who presented with persistent hypoglycemia and critically elevated lactate levels, yet remained neurologically intact despite glucose levels as low as 51 milligrams per deciliter. There was no history of diabetes or use of hypoglycemic agents, and common causes of hypoglycemia such as insulinoma, adrenal insufficiency, and organ dysfunction were all ruled out. Standard intervention, including glucose infusion, were ineffective. So given the concurrent hypoglycemia and lactic acidosis, we strongly suspect a malignancy-associated metabolic disorder, specifically the Warburg effect. Initiation of chemotherapy targeting the lymphoma led to rapid normalization of glucose and lactate. As you can see the figure 1, and over the course of chemotherapy, both glucose and lactate were normalized. So this clinical and biochemical response highlights the central role of the Warburg effect in this patient's presentation. The Warburg effect, first described by Otto Warburg in the 1920s, is a hallmark of cancer metabolism in which tumor cells predominantly utilize aerobic glycolysis, converting glucose to lactate even in the presence of sufficient oxygen, while this process yields far less ATP per glucose molecule, which is only 2 ATP per molecule, versus normal the oxidative phosphorylation, which producing 36 ATP to support the rapid proliferation and survival of malignancy cells, as shown in figure 2. So in our patient, this metabolic reprogramming led to profound hypoglycemia due to excessive glucose consumption and severe lactic acidosis from overproduction of lactate. Notably, the patient exhibited no neuroglycopenic symptoms, likely because the brain adapted by using lactate and an alternative energy source. So this case underscores the importance of recognizing the Warburg effect in lymphoma and other malignancy to guide effective and timely treatment decisions. For patients, awareness of the Warburg effect has direct implications for clinical care. Mismanagement of hypoglycemia and lactic acidosis, such as prolonged glucose infusion or inappropriate use of alkalinizing agents, can worsen the metabolic condition and delay the definitive treatment. Our case illustrates that correcting this abnormality requires targeting the underlying malignancy, not just focusing on the biochemical parameters. Early recognition of the Warburg effect allows for appropriate intervention, reduce unnecessary testing and treatment, and improved patient outcome. Moreover, this phenomena is not exclusive to mantle cell lymphoma. Similar metabolic patterns have been observed in other aggressive lymphoma, such as diffuse large B-cell lymphoma, and further emphasizing its clinical relevance. So the next step in this line of research is to systematically study the prevalence and clinical significance of the Warburg effect in hematologic malignancies. Future research should focus on characterizing metabolic profile in aggressive lymphoma, correlating these findings with tumor burden, molecular markers, molecular pathway, and patient outcome. The Warburg effect also plays a role in cancer diagnostics, such as PET molecular imaging, and may offer a new avenue for precision medicine. Additionally, there's growing interest in novel therapeutic approach targeting cancer metabolism. Strategies under investigation including dietary intervention, such as ketogenic diet, drug delivery system that target glycolytic pathway, and pharmacologic agents aimed at disrupting the glycolysis or lactate transport. Ultimately, integrating metabolic phenotyping into cancer management could enhance personalized treatment strategies and improve the prognostic assessment. I'd like to thank you for your attention and also invite you to read our letter to the editor appearing in the July issue of Mayo Clinical Proceedings.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.